So now there are TEG and the Rotem, both serve the same purpose actually. They are assessing the cellular component of the coagulation as well as the fibrinolysis and the fibrin, the strength and the stability of the clot. But there is only minor subtle differences in the parameters which you use to assess these coagulation assay. For example, the reaction time in TEG is mentioned as clotting time in Rotem. So both serve the same purpose actually. If the reaction time in TEG is prolonged or the clotting time in Rotem is prolonged, you know there is coagulation factor deficiency, you have to replace the coagulation factors. The alpha angle is the same in both. So if the alpha angle is reduced, you know there is fibrinogen deficiency, so you have to replace fibrinogen. Kinetic time is the fibrin generation, that is replaced in Rotem by the clot formation time. So if the kinetic time is prolonged or the clot formation time in Rotem is prolonged, you know again that there is deficiency of the fibrinogen or fibrinogen functional abnormality. You have to replace the fibrinogen. Now coming to the strength of the clot, you use maximum amplitude in the TEG, whereas the maximum clot firmness is used in the Rotem. Maximum clot firmness. So if the maximum amplitude is reduced or the maximum clot firmness is reduced, then that gives you an idea that the platelet fibrinogen interaction is defective. So there is platelet deficiency, you have to replace platelets. Now lysis time 30 in TEG is replaced by clot lysis. That's also the same thing, clot lysis if it is prolonged or the lysis time 30 minutes is more than 7.5%. You know that there is hyperfibrinolysis. So you have to use tranexamic acid to treat the bleeding. So that is in short about the TEG and the Rotem. Now I will show you one result which we received recently in a patient admitted to a hospital. So you can assess that. Here it is written R time. This is by TEG result 9.8 and minutes. Okay, and it is written high. That means R time is prolonged. So now we know that this patient has got a deficiency of the coagulation factors. Either the synthesis of the coagulation factor is defective due to the liver disease, or the patient is taking some anticoagulant. That is why this happened. And the next one, they have given kinetic time 2.2 minutes, but it's in the normal range. Now alpha angle also they have mentioned 58.9 degrees, but that's also normal, within the normal range. Now maximum amplitude they have given 50.8 and the range is 54 to 72. So naturally it is reduced. The maximum amplitude is reduced. Now estimated percentage of lysis, and lysis 30 is reported as it's reported as normal range. So now what is your assessment? The patient here is a patient whose reaction time by TEG is prolonged. So you know there is a coagulation factor deficiency. The kinetic time and the alpha angle are normal. So the amount of fibrinogen is normal. Maximum amplitude is reduced. So there is a possibility that platelet is reduced. The estimated percentage lysis or the lysis time, the 30, are normal. So there is no hyperfibrinolysis. So in short, this patient has got coagulation factor deficiency and thrombocytopenia. So probably it could be due to a liver disease, or it could be due to some other factors. So in this patient, if he is bleeding, he needs a coagulation factor replacement by either FFP or PCC and platelet transfusion to improve the maximum amplitude. This is how the TEG helps you in a bleeding patient. This is especially very useful in a trauma center where a traumatic bleeding patient is brought to the hospital. You don't know what component of the therapy to be given. Immediately transfer the blood to the TEG machine or the Rotem machine. You will get the result within 30 minutes time, and then you can assess the component therapy. Or in a postpartum bleeding in a gynec ward, if the patient is bleeding and you don't know what is the reason for that, just transfer the blood to the machine and you assess the parameters and start replacing the component therapy. Okay, I hope it's clear to you.